Our COVID-19 coverage continues now. We have Dr. James Castillo, the Cameron County Health Authority, joining us now live via Zoom. And Dr. Castillo, we know you are extremely busy these days, so thank you for your time.
Thanks for your help.
First off, your reaction to the governor's mask mandate.
I think that was absolutely the right thing to do. I think physicians across Texas feel that was the right thing to do to try to slow the spread of this virus.
And Dr. Castillo, you are on the ground. You have seen the rising hospitalizations. What is the #1 thing you want people watching this at home to know?
I think it's really, there's 5 proven things to prevent the spread of this virus. Stay home, especially if you're vulnerable and could end up hospitalized because of this virus. Wash your hands, wear a mask, avoid large crowds. That's absolutely the best thing we could be doing to prevent the spread of this virus.
Doctor, we have seen visiting nurses arrive here in the Valley. 2 ambulance strike teams arrived in Hidalgo County just yesterday. What do you need to handle the surge in cases right now from the state or the federal government?
From the state, I think they've sent us help to the hospitals with extra staff to be able to open up more beds to care for patients who keep coming in with this virus, so we can help them have the best chances of surviving it. So from the state, we've been getting a great amount of assistance there, and I think we're going to keep needing more assistance.
We didn't have an infection spike in March, and yet we were under stay-at-home orders back then. Now we have a massive swell in cases. Do you think lockdown measures are needed in order to get our local outbreak under control?
I think lockdown is the absolute last resort. We're going to have to learn how to live with this virus. It's going to be with us for at least a year, even if vaccines come out. So we really learn how to, I will have to learn how to adapt to this. So a lockdown, I think, would become necessary if our hospitals are at the brink of collapse. And we had to, not allow for any more infections. We did the lockdown just in time to avoid this type of surge. I think we did that very early here in Cameron. We avoided this huge surge, but then I think it's become clear we reopened too quickly.
And we have heard that more hospital units are being converted into COVID units, but space is still running out. ERs are packed. We have a big diabetes problem here in the Valley. When you talk about converting regular hospital units into COVID units, does that mean you're taking beds away from those who need it for dialysis and other non-COVID emergencies, and then designating them for those with COVID?
I don't think we're taking away beds from them. Hospitals in the Valley have all been proactive about cutting back on anything that could wait. So a lot of elective surgeries, a lot of elective procedures that could wait have been delayed. That has freed up some capacity in terms of physical space. In terms of staff, we've had to call in extra help already. So I think the hospitals have the capacity to continue to deal with the true medical emergencies that they save lives doing every day. But now they're having to create those special units to safely take care of these patients too. So I don't think they've compromised the care for the other patients, but they definitely have to keep growing the care they need for the patients who keep coming in.
So what happens if we run out of hospital units to take over for COVID patients? Do you anticipate a pop-up medical facility going up here in the Valley?
Yeah, that would absolutely happen if the hospitals run out of all physical space. And there's a lot of other hospitals. We have some long-term acute care hospitals that could flex. The VA might be able to be a source of assistance. But once we run out of all those official structured beds, then you'd see some pop-up type of hospitals along the line of a shelter almost be created to house the patients who don't need ICU care, maybe can get out of the hospital, or the people who are not quite sick enough to be in the hospital. So those in-between patients would probably be housed there to reserve the other medical beds for patients who are in maybe ICU care or really critically ill.
And Doctor, last question. The first confirmed COVID case in the Valley was reported in your county back in March. Do you keep tabs on those early patients? How are they doing, and are they reporting or experiencing any complications?
Most patients with mild disease made complete recoveries. A large portion of our early cases were in nursing homes, which is why our death numbers in Cameron County were so high. For the patients who went through the severe disease where they ended up in the ICU on a ventilator, they're still recovering to this day. Some of the patients I'm in touch with still are making a recovery, but they're nowhere near where they were before, especially if they were in their 70s or 80s. So it's a very long road for even the survivors. But for most people, they did make complete recoveries.
Dr. Castillo, thank you for your time.
Thank you.